My name is Leah Morris, and today I will be doing the medication administration checkoff. Okay, so we're going to go around the room. Okay. So the first thing I'm going to do is I'm going to make sure I am in a no interruption zone. So I'm going to keep all doors to the medical room closed. I will not take any phone calls, and I will limit communication with my colleagues to essential information only. The next thing I'm going to do is compare the patient order form to the MAR and do the 7 rights of medication. So we have the right patient, Jaguar J. Jones, date of birth, 8/25/1963. 8/25/1963. Medical record number is 4176352, 4176352. We have the right medication, morphine sulfate, The right dose, 5 milligrams, 5 milligrams. The right route, IM, or intramuscular. The right time, every 4 hours, The right indication is PR in pain, or as needed for pain. Now we're going to check to see if the patient has any allergies, and the patient has an allergy to penicillin. Okay, the next thing we're going to do is we're going to perform hand hygiene, and we're going to begin with our first check of accuracy in the 7 rights. So we're going to start with the right medication. So we have the vial. The right medication calls for morphine sulfate. We have morphine sulfate. I'm also going to check the expiration date on the medication. And so we have morphine sulfate, and the expiration date is good. Okay. And right indication, morphine sulfate is used to give relief to ongoing pain that a patient may have. Okay, so the next thing we're going to check for is going to be the right time. So the order says morphine sulfate 5 milligrams IM every 4 hours. So it has been 4 hours since the medication was last given, so it is okay to give it. Next thing we're checking for is the right route. We have morphine sulfate 5 milligrams IM, which is intramuscular. So we have the correct syringe, which is 3 milliliters. We have a plastic cannula, and we have a 23 gauge needle. Okay, so the next thing we're going to check is the right dose. So the order calls for morphine sulfate 5 milligrams. In our vial, we have morphine sulfate 10 milligrams. So that lets us know that we're going to divide, and that's going to give us 5 milligrams to pull, or half. So we will either pull 0.5 or half of the morphine sulfate in the vial. So the first thing we're going to do is we're going to clean off the top of our vial. Okay, and we're going to get our syringe, and we're going to make sure that we do not contaminate at any time. Get our syringe. We're going to get our plastic cannula, twist on. Okay, and so we're going to draw up 0.5 or half of air in our syringe. Okay. Trying to make sure we're right on it. There we go. Yes, we have drawn up half. It's a little hard to see. We have drawn up exactly half in our syringe, okay? So we're gonna take the top off, and we're gonna inject the air into the syringe, okay? We're gonna flip over, and we're also gonna pull half of the medication into the syringe. Yes. Okay, we are spot on. And we're going to use the scoop method. And we're going to recap. Okay. And we have drawn up half. It's right on the line of half. Trying to see the best way. Okay, it's right on the half. There we go. You can see it right there. Right on the half. Okay. So from here, what we're going to do is we're going to twist off the cannula. We're going to dispose. And we're going to get our 23 gauge needle. We're going to insert. Okay. So from here, I would have another nurse double check my calculations as well and make sure that I've drawn up the correct amount of what's supposed to be given. And I'm going to do my second check of accuracy at this point. So I have Jaguar J. Jones as my patient. Date of birth is 8/25/1963. Medical record number is 4176352. Patient has an allergy to penicillin. Okay, so making sure we have the right medication. We have morphine sulfate. It calls for 5 milligrams. We've drawn up half, so we know that we have 5 milligrams in the syringe. IM is the route. We have the correct syringe and needle to give an intramuscular injection every 4 hours. It has been 4 hours since it was given, as needed for pain, and Mr. Jones is complaining of pain, so we do need to give the medication. So the next thing I'm going to do is I'm going to make a label for my syringe. And on my label, it is going to have the patient's name, Jaguar J. Jones, the medication, morphine sulfate, and the dose, the amount that's going to be given, which is 5 milligrams. So we have Jaguar J. Jones, morphine sulfate, 5 milligrams. Okay. And we're going to attach this label around our syringe, where we're going to make sure that we can still see the numbers of what has been drawn up. Okay. From here, we're going to take our syringe, our vial, and our MAR, and we're going to move over to Mr. Jones's room. Make sure we can see everything. Alrighty. So I would come in, introduce myself. Hi, Mr. Jones. My name is Leah Morris. The first thing I'm going to do is I'm going to perform hand hygiene. And I'm going to start with my 2 identifiers for my patient. So we have Jaguar J. Jones, shaking the wristband. Jaguar J. Jones. Date of birth is 8/25/1963. 8/25/1963. Medical record number 4176352. Medical record number 4176352. We'll also check to see if he has any allergies, and Mr. Jones has an allergy to penicillin. And also I would ask Mr. Jones if he has any other allergies that he would like to inform us about at this time. Okay? The next thing I'm going to do is I would go ahead and do my pre-administration assessment. So I would check blood pressure, respiratory rate, and I will also do a pain assessment on Mr. Jones. And from here, I'm going to go ahead and do my third and final check of accuracy. So we have Jaguar J. Jones. His date of birth is 8/25/1963. 8/25/1963. Medical record number is 4176352. 4176352. He has an allergy to penicillin. No other known allergies. Now we're going to make sure we have the right medication. We have morphine sulfate. We've drawn up morphine sulfate. 5 milligrams is what it's called for the dose. We have the right dose, which is half, 5 milligrams. The right route is going to be the intramuscular route. We have the correct syringe and needle. The right time is every 4 hours. It has been 4 hours since it's been given. The right indication is as needed for pain, and Mr. Jones is complaining of pain. So we are good to give our injection. So the next thing we're going to do is I am going to raise the bed to a working height. I will lower the side railing, and I'm also going to explain to Mr. Jones that today I will be giving him a morphine sulfate injection that's going to help give him some pain relief today. And the next thing I'm going to do is I'm going to go ahead and don my goggles and my gloves. Okay. Okay. So I would already have Mr. Jones I would position him in the correct position that we need to give the injection, and we're going to give it in the ventrogluteal. So I would palm the greater trochanter, and I would use my pointer finger to go to the anterior iliac spine, and my middle finger would go to the iliac crest, and my thumb would be towards the pubic area. And in between my middle and my pointer finger is where I would give a 90-degree injection. But we're also going to assess the skin integrity and see if there's any bruising at all. So the next thing we're going to do is we're going to go ahead and we're going to clean our injection spot. Okay. Clean. All right. We're going to get our medication. We've already checked to make sure that we have the correct medication. Okay. We're going to pull the skin tight, and we're going to give a 90-degree injection. We're going to aspirate for any blood, and we do not have any blood, which is good. So we're going to go ahead and give this injection, and we will give it slowly. Okay. Now that we've done that, we're going to get our wipe, and we're going to apply pressure to the spot, and we're going to dispose in the sharps container. Okay. Now that we've done that, I would reposition Mr. Jones. I would lower the bed, raise the side railing back up. Okay, and we're going to go ahead, we're going to go dispose of our clean gloves. Okay, dispose of our clean gloves and goggles. And I would assess Mr. Jones to see if he had any type of allergic reaction or irritation from giving the injection. Okay, then I would leave and I would document. I would document the medication that was given, the amount that was given, and also how Mr. Jones tolerated the procedure. And then I would come back in about 30 minutes to check on him, being that I did give him a pain medication. And that is going to be it for the checkup.